Pregnancy and contraception. Contraception may need to be reconsidered if you are a lady and you normally use the contraceptive pill. It would be advisable to discuss this with your GP or your family planning clinic, as some medications are absorbed differently than others and may not be completely effective if you have an ileostomy. Stoma surgery sometimes alters the anatomy of the vagina and the uterus, and that may mean insertion of the diaphragm or the IUD may be difficult. But there are lots of other options available, so it's really important to go and discuss it with your GP just to explore all the positives and negatives of maybe trying out a different contraceptive. Pregnancy is a really good outward sign that your body has healed and that you are able to perform just the same as anybody else with or without a stoma. But you're probably going to have many questions. The main questions that people that have come to me before would be, well, how will my stoma cope with a growing pregnant belly? Well, actually, do you know what? It copes really, really well. But it's really important to keep in touch with your stomach care nurse, because as your expanding tummy gets bigger, your stoma is going to stretch in size as well. So it's going to be really important that you keep an eye on the size of the stoma so that the actual shape and size of the flange of the bag that you're using fits really well and molds around nice and easily around that expanding tummy. People will also wonder whether you'll be able to have a normal delivery or would it be a cesarean section. Well, actually, as far as possible, your doctor and your obstetrician and your midwife would prefer for you to have a normal delivery in most circumstances. Cesarean section is actually a major operation, and really they would try and avoid having to cut into your abdomen, because that just can lead to other problems as well. But there will always be exceptions to that, and it's really, really, really important to discuss your plan, your birth plan, with your midwife and your obstetrician as early as possible in your pregnancy journey.